Body regions and anatomical terminology. Anatomical position: arms down by side, palms up, head and eyes forward. Legs parallel, feet together. Coronal/sagittal/transverse planes. Coronal plane, frontal plane. Sagittal plane, lateral plane. Transverse plane, axial plane. Coronal plane aka frontal plane. Vertical plane running from side to side. Divides the body or any of its parts into anterior and posterior portions. Sagittal plane aka lateral plane. Vertical plane running from front to back. Divides the body or any of its parts into right and left sides. Transverse plane aka axial plane. Horizontal plane. Divides the body or any of its parts into upper and lower parts. Anterior/posterior. Anterior, to be situated near or toward the front of the body. Posterior, to be situated toward the back of the body. Superior/inferior. Cranial/caudal. Superior, means to be situated toward the upper part or head of the body, positioned above another organ or structure. Inferior, to be situated toward the lower part of the body or positioned below another organ or structure. Cranial, refers to the head end. Caudal, refers to the tail end. Superior/inferior. Cranial/caudal. Medial/lateral. Medial, to be closer to the midline of the body or a structure, being internal as opposed to external. Lateral, to be farther away, in the direction of either side, from the midline of the body or a structure. Proximal/distal. Proximal, toward or nearest the trunk or the point of origin of a part. Distal, away from or farthest from the trunk or the point of origin of a part. Unilateral/bilateral. Unilateral, on one side. Bilateral, on both sides. Acute/chronic. Acute, symptoms appear and change/worsen rapidly, heart attack. Chronic, develops and worsens over an extended period of time, atherosclerosis. Atherosclerosis, a common arterial disease in which raised areas of degeneration and cholesterol deposits, plaques form on the inner surfaces of the arteries obstructing blood flow. Ipsilateral/contralateral. Ipsilateral, on the same side as another structure. i.e. the left arm is ipsilateral to the left leg. Contralateral, on the opposite from another structure. i.e. the left arm is contralateral to the right arm, or the right leg. Superficial/intermediate/deep. Superficial, near the outer surface of the body. i.e. skin is superficial to the muscle layer. Intermediate, between two other structures. i.e. the navel is intermediate to, or intermediate between, the left arm and the contralateral, right, leg. Deep, further away from the surface of the body. i.e. the muscular layer is deep to the skin, but superficial to the intestines. Superficial/intermediate/deep. Avascular. Without blood circulation. Ectopic, occurring in an abnormal position or place. Ectopic pregnancy equals a complication of pregnancy in which the pregnancy implants outside the uterine cavity. Ectopic kidney equals not located in the usual position. Body cavities: thoracic cavity, abdominal and pelvic cavity. Dorsal cavity. 22. Thoracic cavity: upper ventral, thoracic or chest cavity contains heart, lungs, trachea, esophagus, large blood vessels, nerves, bound laterally by ribs and the diaphragm caudally. Abdominopelvic cavity. Lower part of ventral cavity. Abdominal. Gastrointestinal tract. Kidneys. Adrenal glands. Pelvic. Urogenital system. Rectum. 24.